No, you're good. You're good there. So just find your patient, click onto the name of your patient, and then hamburger new encounter, so that we can have a new chart. And just make your screen like that.
The name,
nice and
not the
nice.
door, right?
Yeah, so you can click the name of the patient and then hamburger new encounter it. Just like, and your patient should be in the room.
He's gonna walk in.
Let me know if you need any help getting that new chart. And again, clear out the medical history from that left-hand column. The allergies, the problems, the meds. Go ahead and clear that all out. So, no. It's just like, it says now it's like, whatever shows up in the air.
Still can't
This one should be working. Alright. So again, make sure to clear out that medical history from that left-hand column. Make sure to plug in the charger on that.
Okay.
Might be already used. USB-C, right?
Oh, sorry. Yeah, put it to USB-C.
I'm not supposed to. Only this week.
Everyone good?
Yeah, because I cannot like be focused for 8 hours.
Alright, cool. So, at this point, you can assign the patient to Dr. Sultan. Let's do Sultan, S-U-L-T-A-N, and we're going to be in room number 1. Room number 1. Leon Sultan, room number 1. So we get into the chart, go to exam, right? You have to prep that chart, so go ahead and prep your chart. Ready for provider to with provider. Select location, room number 1. We already added in the vital section. And the fourth and final step, urgent care. Reason for visit, we add in urgent care. So those 4 steps to prepping every single chart. Ready for provider to with provider. You select the location, which is room number 1. You add in your vital section and then urgent care. Do control that.
Oh, I found it, yeah. Thank you.
Yeah.
On the top where it says office visit, like if this patient actually was just going as like an established patient, would it automatically recognize that or
Yeah. No, so if the patient, you see at the top next to the location, it says office visit new. The PSR, when a patient comes in, they'll register them as an established patient. It'll show office visit established, PSE, instead of office visit new. All right? So just so you're aware, if it's a new versus established patient. All right, so everyone has a prep chart ready to go. How are you going to adjust the flags before you go grab the patient? What flags are you going to put up for the patient? Blue and red, very good. I'm ready as your patient. My name is Scribe 26 Test. I'm a 50-year-old male patient, will do. And I'm waiting for you, so you can come grab me from the front. Yeah, physically grab me. I'm waiting.
Patient test.
Hello.
My name is Brandon. This is assistant today.
Nice to meet you. You get into the room, sit down. Where do I sit down? Chair, the big exam chair. Right, we sit down on that patient chair. You can pretend I'm seated there. I'm going to move around. But I sit down on the chair. What's the first thing you have to verify with me?
Your name, date of birth, and pharmacy.
Yeah, of course. So my name is Scribe26 Test, and my date of birth is 5/25/73, and my pharmacy. Let's get rid of that old one that's there. We'll do the CVS on 93rd and Broadway. CVS on 93rd and Broadway. You remember them from when you were a scribe? You'll remember the closest pharmacies next to your home. CVS on 93rd and Broadway. This is more so closer to my house.
All the ones I work at, that's what I'm doing.
Yeah. CVS on 93rd and Broadway.
It's not coming up.
Just type in 2495. Don't put the whole address. Just do 2495. It should show up. 2495 Broadway.
Thank you.
So we have our pharmacy down. What's next in our process? Before that, right? So you'd sanitize, you put on your gloves, you would run your vitals. Now really quickly, with those vitals, I'm going to ask you the questions. Before you can put that blood pressure cuff on me, what do you need to have me do?
I have to have you relax.
Okay.
Your feet uncrossed.
Yep.
And then I have to actually preference of arm.
Preference of arm, right? So uncrossing the legs, relaxing the arm as well, not just uncrossing the legs, but relaxing the arm as well, and also preference of arm. Those three components. All right, blood pressure's done, vitals are done, temperature's done, oxygen. Remember with that O2 sat, that pulse oximeter, what do you have to do before you put it on the patient's finger?
Alcohol swab.
Wipe it. Where do you find that alcohol wipe?
In the drawer.
In that top drawer. All right, we wipe it, we do our vitals, vitals are done. Before you go back to your seat to document your vitals, what's your question to me?
What brings you into that? What's your main complaint?
Um,
That's not gonna be that one. It's gonna be the one with the lower side. It's gonna be the one with 10 minutes. I changed myself to a 34-year-old female, just for fun. Anyways, let's click on go to it. So I tell you, I'm having abdominal pain. Do you need to run any point of care tests on this patient?
yeah.
No.
Yes. Wait.
Abdominal pain in female patient of childbearing age. You're going to need to
Pregnancy.
do the pregnancy and the UA as well.
Oh, okay.
UA and UPreg you need to run on female patients of childbearing age with abdominal.
Okay.
That's why I said that. All right. Female patients of childbearing age with abdominal pain need to run UA, UPreg. Now, do you want to do that right now or afterwards? Because I have to leave the room. I don't want to leave the room right now. All right. So we can go back to our seat and we can document our vitals. Let's document some vitals for the patient. Here. Vitals are the section, remember, is in the middle of the chart. So right below reason for visit, you have the vitals. It's on the document. Yeah. So ask me the question.
More or less, how tall you say you are?
I am 5'9".
And what is your guesstimate weight?
180 pounds.
Damn.
My blood pressure you can put as 120/80. Heart rate you can put as 80. Temperature 98.6. Rest rate is normal. If I was breathing abnormally, how do you calculate it? Rise and fall for 15 seconds multiplied by
4.
Alright, O2 sat 99. And keep it simple.
Wait, what was the pulse?
80.
80.
Oh.
What do you do if
Alright.
the O2 stat is like low?
You're expected to retake it. Sometimes it comes out funky. just retake
Wait,
it.
O2
And
is
if it's
80?
still like really
Is it?
low, it depends. If the patient looks like they're
92.
breathing fine, they
99.
look normal,
Yeah.
you're okay. If the patient you see them visibly struggling to breathe, go get the doctor.
Yeah, cause I'm trying to figure out like, what if there's like an emergency situation, like
Yeah.
while you're taking the vitamins, like you just immediately get the provider.
Yeah,
and you're
get the
like,
provider.
Okay.
Yeah, get
Cause
the
then it'll
provider.
just go into the ER cent.
Yeah, sometimes there are going to be cases where you don't do any. On that chart is going to be mostly empty.
Okay.
You just have vitals in there, and nothing else.
Okay.
Because maybe the patient fainted when they came into the room or something like that. They sent them automatically to the ER. That's it. We do what we can.
Imagine.
Okay.
That was their
Is there
class.
ever a situation
No, I'm
which
kidding.
you ask on a scale from 1 to 10 how their
What
pain
happens
is
in
for
the
you?
We
I
don't
didn't
do
think I
pain
just went in
scales.
there and they didn't do anything because I couldn't
And I
breathe.
assume you just grab any provider. It doesn't matter if they're assigned to them or not.
Yeah, ideally you would want to grab the provider that's assigned to them, but in situations where you can't find them, just grab anyone. All right, grab anyone. Ideally, you want to pick the same provider, but if you can't find them, just pick a and change the provider later. All right, cool. So vitals are documented. Now you can get into medical history. So remember to give me that disclaimer before proceeding to medical history.
Do you have any known allergies to any medications?
Very good. Now, before you ask that question, like I said, give me that quick disclaimer. Hey, before we get into why you're here today, I just want to ask you a few questions about your medical history first. Again, something we look at during your practical. We count it if you don't tell us. Right? So again, you're asking for a grading criteria. I'm giving it to you throughout this. Give me that disclaimer. Yeah.
This is a random question. When I was doing the practice case in the room, and I asked the guy to take off his jacket and unfold his arms, make sure his legs aren't crossed, would I have got points for saying that, even though I didn't say which preference of arm, would it still would have deducted points?
If you didn't ask for preference of arm,
Yeah, but I said everything
you would have gotten
else.
points off for it.
Oh, okay. Do I get points for what I said? Though, or
Yeah.
no? Okay.
You get points for what you did and what you didn't do.
So this is a time test. Like when we're putting like all these disclaimers and all that, that kind of not waste time, but it interferes with time. That's
part
probably
of
why we don't do it.
It's part of it, right? It's part of it. It's part of our process. You should be able to finish within that time.
Would you say it again? So you just say like we're gonna.
Yeah, I'm just gonna ask you a
Question
few
about your medical history?
before we get into why you're here.
Before we get.
Yeah, before we talk, we dive deeper
Is
into
it one of
it.
those things like you think like it gets like a lot easier like the more you do in terms of
Yeah.
like, transitioning because like you see how like in the room there's like a few like quiet moments and like, I feel like it tends to get a little overthinking almost.
Yeah. It takes time, right? So especially during the exam, you're gonna be a little bit nervous because it's an exam. It's a matter of being able to interact with the patient in an appropriate way. So that's part of that disclaimer is part of patient interaction skills, right? Being able to guide a patient through a visit by saying, hey, before we talk about why you're here today, acknowledging that you have this, I understand you have it. I do need to ask something else first, so the patient feels acknowledged.
So when we do the practical, is it going to be on an actual patient or is it going to be on a worker?
It's going to be on like a patient, so one of us will be acting as the patient
But
provider.
I'm saying like, so what's the other?
Yeah, it's a typical sick visit.
Okay.
It's not like a workers' comp, if that's what you're asking.
No, I was going to be working on the actual patient, one who just came in.
Oh no. It's a fake. It's a fake. It's not like a. We're not letting you treat real people yet.
Okay, great.
So in that environment, like in the practical space, it's gonna be us and one other person.
Yeah.
Okay. Okay.
All right. Yeah.
When it comes to the disclaimer, can we ask them like, is that okay? Like, I'm gonna ask you a couple questions regarding your allergy history.
Yeah, that's okay. Yeah. Before.
Is there any like instance where let's say like no, like they won't want it?
We won't be annoying.